And millions of Americans who depend on Obamacare subsidies are still in limbo. As Scripps News congressional correspondent Nathaniel Reed has more on that.
On Capitol Hill, 17 Republicans voting to defy party leadership on Thursday, supporting a bill that would bring back expanded Affordable Care Act tax credits, which expired at the end of last year. Those Republicans who sided with Democrats saying they wanted to send a message, not just to Speaker Mike Johnson, Senate Majority Leader John Thune, and President Trump, but to Americans, to say they're serious about addressing the high cost of health care.
Today's vote was to move a bill to the Senate so that the Senate could come back with a bipartisan compromise. The 3-year extension is not going to become law. The Senate voted it down weeks ago. I think today's vote with 17 Republicans joining with 213 Democrats sends a message that there is bipartisan support.
Negotiations over a deal currently underway in the Senate appear to remain far off. Republicans have insisted that any agreement to lower the cost of health care cannot allow any federal funding to be used for some reproductive care services, specifically abortion care. Democrats say those restrictions are a non-starter as lawmakers look to do something to address insurance costs ahead of the midterm elections later this year. On the table, a possible short-term extension of Affordable Care Act tax credits, which could include a transition to health savings accounts for Americans who get coverage under the ACA to help them pay down the cost of their health care. If lawmakers end up reaching a deal, another practical issue that will need to be addressed, open enrollment. It ends on January 15th for Americans who receive coverage under the ACA. But if Congress passes a bill to lower insurance premiums, lawmakers will likely need to vote to open up another re-enrollment period so Americans who've already locked in their health care plans for 2026 or declined to do so because of rising costs can get covered. Nathaniel Reed, Scripps News Group, Washington.
Affordable Care Act open enrollment period ends January 15th, and that means millions of Americans are now facing tough choices when it comes to choosing the right insurance plan. ACA premium tax credits expired at the end of last year, causing significant price hikes for policies. And with all of that uncertainty, you may be wondering how to choose the right plan. To help sort things out, let's bring in Senior Policy Officer with the Robert Wood Johnson Foundation, Catherine Hempstead. Thanks so much for being here today.
Sure, thanks for having me.
Okay, so as we mentioned, open enrollment ends in less than a week. So what's the first thing people should do today to make sure that they have the right plan before it's too late?
Well, I think people need to look at what's available for them in their area and their state, and they should not just blindly re-enroll in the coverage they had last year because they might find that that's not affordable at this point. So people ought to look and see what's offered. Some people may decide that they would be better off to shift from a silver plan to a bronze plan to get a less expensive premium, even though that will expose them to more cost sharing. I mean, that's an unfortunate trade-off, but I think a lot of people would feel like that's better than having no coverage at all. And people should keep watching the news because, as you know, this is a fluid situation, and it's possible that there may actually be a fix and that Congress may decide to extend these tax credits after all, or in some fashion.
And Catherine, there are dozens of plans available. So how can you determine which one might be right for you and your family?
Well, that's a great question. And you're right. There are dozens of plans, and some people have felt like there are sort of too many plans and people get overwhelmed by choice. The important thing to remember is that the coverage is the same. The things that the ACA compliant plans cover is the same. What's different is the different metal levels determine sort of the way the coverage is financed. So higher metal levels mean higher premiums and less cost sharing. Lower metal levels mean that your premiums are lower, but your deductible is going to be higher and your out-of-pocket max going to be higher. Most people like a silver plan. That's sort of the majority plan, is kind of in the middle. But as premiums have gone up so much, many people are going to have to make that sort of tough choice and say, I can't afford silver right now, I better go to bronze, which will give them maybe a more affordable premium. But the downside is that they'll need to spend more out of pocket. I think aside from that decision, the other thing that people might be interested in, and this is sort of across the board always true, is looking at what do the provider networks look like in these plans? Where can I find the doctors that I like to see? What medications are covered? in the formularies of these plans. These are things that, you would look at every year regardless. But I think in terms of reacting to the big premium increase, a lot of people are reconsidering what metal level is right for them.
Are there specific resources that people can tap into for more personalized help in choosing the right plan for them?
Definitely. It's a hard question to answer, give one answer for a national audience, because there are many states that have their own state-based marketplaces that are run by the state, and those are great resources for people that live in those states. But for other states, it's the federal marketplace, which is called healthcare.gov. But I'm just going to say healthcare.gov is a great universal answer to give, because no matter what state you live in, if you go to healthcare.gov, you'll get directed to the right resource from your state. And it's really important to make sure you're really there, because unfortunately, if you just, put in a search term, there's lots of scam websites that try to jump to the top and get you to click on them instead. But I would go to healthcare.gov, and then many people work with a broker. That's definitely a good thing to do. It's good to know something about the broker. Maybe you have a friend or neighbor that use them, but lots of times brokers can give people guidance and help them determine between the different plans.
And we know the deadline to enroll is January 15th. What happens if you don't enroll, if you don't make that deadline? What happens?
Well, that's, again, a complicated answer. There are actually a few states that are exploring extending their deadline to January 30th. I'll just hold that to the side. If there is some kind of congressional deal on the subsidies, it is likely that there might be a new special enrollment period for people to go back and, people that may have sat it out, go back and take a look, or maybe allow people to change plans if the prices change. But holding all that stuff aside, the way that you can get coverage after open enrollment ends is if you have something happen to you that makes you eligible for a special enrollment period, like, for example, you move to another state, or you lose your job, or you have a change in, you age out of coverage that you might have had under your parents' plan, or, something like that, that will qualify you for a special enrollment period. So, I wouldn't bank on any of these other things we talked about happening. So I think if you're wondering whether or not you should get coverage, and you think you might want to have coverage in the individual market, this is your time to get it.
One solution being floated by Congress is allowing patients direct deposits into health savings accounts to manage their own health care costs. Just wondering if this is a viable solution, or if this is going to help those who are confused, or is this just going to muddy the waters?
There's an increasing interest in allowing consumers to have a little bit more agency in shopping for care, and there's a thought that this may, contribute to reducing costs. I think there's sort of a generalized feeling, even going outside of the individual market, that, people are disappointed with how expensive it is for them to access healthcare within insurance. So I think this interest in creating these accounts is kind of a real thing, and it's something to pay attention to. I think in the immediate short run, giving a very small number of consumers in the individual market a little bit of money isn't really going to give them any market power, and they're not necessarily going to be able to do a lot to find lower prices. And if they spend a lot of money that's not counting towards their deductible, they're kind of, shooting themselves in the foot in a way. So I think there are some, questions about how impactful it would be in this context, and also it would be relatively complicated to implement. But I do think that there's a lot of interest in it, so I wouldn't be shocked to see that is part of at least something that comes up for discussion as a bipartisan agreement to extend these tax credits. And I understand sort of where it's coming from.
Catherine Hempstead, Senior Policy Officer with the Robert Wood Johnson Foundation. Thanks for your time and your insight today.
Sure. Thank you for having me.